When discussing corrective exercise for the shoulder complex, we want to make sure that we have upward rotation of the scapulothoracic joint. So we've talked about before, soft tissue work in the pertinent areas, whether it's the rhomboids, the lat, pectoralis minor, to free up the mobility, the extensibility in those tissues to let the joint move should be your first step. From here, we now have to strengthen or activate the muscles that create that upward rotation. Many different ways to do that. We're going to borrow a variation of Shirley Sarman's exercises here. This is just going to be a standing movement where we're going to use no resistance, just our body weight and gravity to go through this range of motion. The greater shoulder flexion that someone has available to them, the closer to the wall that you are. The greater deficits that they have in shoulder flexion, the further away from the wall that you'll be. Now the wall is here as a nice guide for tracking. You can compare asymmetries from side to side. We just want to either track the pinkies or the fingers gently as we move across. We're going to encourage just someone moving up and through some upward and downward rotation. Once we've done a few repetitions there, we'll get to the top. Don't have any pinching, stop just short of that. Once we get to our end range of motion, then we'll just get some gentle shrugging from this position. That shrugging is going to be elevation and upward rotation of the scapulothoracic joint. From there, we'll progress, put it all together. We'll get some upward rotation, some shrugging, then we'll straighten out the elbows, open up the fingers, and then we'll get some scaption at the end to engage a little bit more of the lower trapezius. Slow and steady as far as our tempo goes here. Face the wall. Nice and easy upward rotations. Compare asymmetries, get a feel for the fingers. Stay neutral here. Once you've done a few of those, get some shrugs at the top. Once you've got those down, one of the mistakes that I see is people go right down to prone scaptions on a stability ball or standing scaptions, and they don't quite have the mechanics of the glenohumeral joint or the scapulothoracic joint, so they end up with that scapular dyskinesis or faulty movement, where they end up bending the elbow or shrugging or protracting. But using an exercise variation like this over days or weeks, or even within the same workout, might help someone progress to get where they need to go. If you've got some pinching or impingement, back off in the range of motion, get the soft tissue work in. If you continue to get pinching or discomfort, you might want to see someone and take a look within the joint and see if you do have some inflamed tissue or there's another diagnosis there. Hey, that's what licensed medical professionals are for. Thanks for watching. I hope this helps keep your shoulders healthy. I'm Eric Beard.